Hi, my name is Alyce Sweet, and this is a short presentation on what can healthcare professionals do in their personal practice to reduce discrimination and stigma associated with certain conditions. Briefly, what is stigma and discrimination? Salters Panout offers this definition of stigma. Stigma is a perceived negative attribute that causes someone to devalue or think less of the whole person. And the Cambridge Dictionary states that the definition of discrimination as treating a person or a particular group of people differently, especially in a worse way from the way in which you would treat other people because of their skin colour, sex, sexuality, etc. Some points to consider. Can you think of a time that you may have shown stigma or discrimination towards somebody? Was it intentional or not? Has anybody ever shown stigma or discrimination towards yourself? If so, how did it make you feel? How might stigma and/or discrimination be shown in a healthcare setting? In the healthcare field, practitioners come across all different health conditions with all different risk factors. With or without intention, a healthcare practitioner may respond to some information showing some discrimination or stigma. They may move away slightly from a patient after hearing that they have a contagious illness. They may talk slower and more pronounced after seeing that their client is not of a Caucasian background, rather than finding out that they are Australian-born and speak fluent English. They may assume that their patient engages in high-risk behaviours because of a positive HIV status, rather than listening to the client's background. They may only look at a particular patient as that cancer patient, rather than who they are themselves. And they may have perceptions that obese patients are unintelligent, unsuccessful, weak-willed, unpleasant, overindulgent, and lazy, rather than finding out the underlying reason for the weight gain. Another point to consider: what are some other ways that stigma or discrimination may be shown in a healthcare setting? What could showing stigma and/or discrimination do to a patient? Healthcare professionals could destroy all the previous work from their patient by showing stigma and/or discrimination. They may prevent patients from opening up or disclosing other information about themselves or family history in fear of stigma or discrimination being shown. The patients may avoid testing and/or treatments, and they may avoid medical attention altogether. It may create anxious thoughts and behaviours in patients that just aren't necessary, and it may have taken years for this particular patient to come in and see this healthcare professional, and this could cause a significant setback in their road to recovery. Some points to consider. How do you think you'd react if someone showed you stigma and/or discrimination in a healthcare setting? Do you think you'd react in a similar way to above, or do you think you'd react differently? Included with this slide is an image that shows how stigma can lead to illness. Many of the people most vulnerable to HIV face stigma, prejudice, and discrimination in their daily lives. This pushes them to the margins of society, where poverty and fear make accessing healthcare and HIV services difficult. How should a healthcare practitioner reduce stigma and/or discrimination shown? Healthcare professionals should monitor behaviours and thoughts to reduce stigma and/or discrimination. Some things to be mindful of include maintaining good body language, not leaning away or moving away from a patient, being mindful of your facial expressions, not screwing up your face when you hear particular information or rolling your eyes, etc. To never assume. Wait and listen to all the information before coming to a conclusion. Use correct wording appropriate to the patient. Never to generalize, making statements such as, does no one with HIV/AIDS understand what a condom is? Showing encouragement, praise, and being invested in the patient's healthcare concerns. Being open and honest, but mindful of the ways of how to express your honesty. Another point to consider: are there any other ways that you could think of to reduce stigma or discrimination shown in a healthcare environment? Some reminders. A healthcare professional is someone whom a patient can trust and confide in. The patient needs to know what is said is confidential. and the patient also needs to feel no stigma or discrimination with any of the information that is provided to the healthcare professional. A healthcare professional should never show discrimination or stigma and should always remain professional, no matter the circumstance.